Okay, people ask me what supplements can I take along with exercise, of course, to repair and build bone. Vitamin K is one of the more important ones that we all forget about. Unless you're eating a ton of natto, like we discussed, which I don't, or aged cheese to an exorbitant amount, which you don't want to do that all the time either, you probably should be taking vitamin K2. So we have one that is in olive oil, which helps it absorb easier, and olive oil is naturally anti-inflammatory as well. So it's got 500 micrograms of K4 and 200 micrograms of MK7, and then 400 milligrams of extra virgin olive oil, of course. Now, this is going to reduce your risk of atherosclerosis while at the same time helping your osteocalcin function better for the proper mineralization of your bone. K2 isn't talked about enough in America. Again, it's indicated for osteoporosis in Japan. I take K2 because I know that it's going to help my heart health and my bone health. And even though the government doesn't recommend it as a form or a way to treat osteoporosis, I do because I believe all the basic science studies. So I think K2 is a good place to start. But probably the basics is going to be calcium and D3. So let's talk about that. The connective tissue multi and the CBD multivitamin that we have are two ways to get everything you need for not just proper bone health, but proper immune health too. So calcium, about 360 elemental calcium carbonate in this actually, and then calcium citrate in the connective tissue multi, about 1,200 milligrams. Remember I told you that's what I take on a daily basis. Magnesium, also important for proper mineralization of bone, 300 milligrams. Vitamin C, which is important for collagen fiber cross-linking and is a cofactor for collagen formation, about 1,000 milligrams. D3, about 3,000 international units. I'll supplement and take more sometimes even. I like to go up to about 4,000. And then zinc, which is a cofactor for many, many enzymatic properties of the immune system and really the whole body system. But the connective tissue multi and the multivitamin here is going to give you your calcium, your magnesium, your D3, and your C, which we don't really talk about, but it's very important for that connective tissue, the tensile aspects of your tensegrity functions. So K2, the connective tissue multi. That's what I would say start with for bone health. And then exercise, so resistance training. You've got to build muscle. And then if you remember from the talk, don't just build muscle, but also work on your balance. Because most people that break their bones have normal, they're not osteoporotic bone. So you have to have good balance, then work on your strength, and then, also take supplements at the same time. These are typically what I take. I take the connective tissue multi on a daily basis and the K2.